Thank you very much, Minister. In the last 24 hours, we have 1,158 new cases to report in Queensland. This brings the total to 4,779 active cases at the moment. Yet despite this very large number of cases, we are seeing very few cases that are sick in hospital. Only 6 patients in hospital currently receiving active treatment for significant COVID-19, and no patients in intensive care or on a ventilator. This indicates that the vaccines are working. But we do encourage everyone, particularly the elderly, and those who with underlying immune disorders, to come forward and get their 3rd dose as soon as they are eligible. At present, that is 5 months after your 2nd dose, and that will reduce to 4 months after your 2nd dose in January. But at the moment, it's 5 months after your 2nd dose. Please come forward and get your booster, particularly if you are at higher risk of infection. But so far, we are not seeing large numbers of patients being admitted to hospital, despite significant transmission throughout the Queensland community. Okay, so the cases are being reported from across the state, from north to south. Many of the same locations reported previously. Some new places that we've seen in the last 24 hours include Port Douglas, Cairns, Townsville and Roma. One thing we have noticed is that we are now texting people with their results as soon as we get a positive result, so that people have the opportunity to isolate as soon as possible, even before they get their first phone call from a doctor or nurse. We have noticed that when people get this report, some of them are going straight to the emergency department, even if they are quite well. And this is causing a little bit of a problem in some of our emergency departments, and it's not necessary. So I would like to remind people that if they do get this text, if they are relatively well, please stay at home. Please only go to the emergency department if you have significant symptoms like breathlessness or chest pain. You will be contacted by a doctor or nurse, and there will be instructions on the text message that you receive. If you are unsure, you can contact your GP or call 134 COVID. So you only need to go to the emergency department or dial 000 if you have significant symptoms like breathlessness. So more information about that is available on our website. We have currently 976 patients receiving care at home. And as I said before, they're just the 6 cases with patients with significant symptoms in hospital. Now, with regard to the day 5 testing, we have been following the results of these tests for the past 2 weeks, since the borders opened on the 13th of December, to see how many people are actually testing positive from them. We have data for the last 7 days, or for the 7 days leading up to the 26th of December, on 24,084 tests in a cohort here in southeast Queensland, and only 0.6% of those tests came back positive. And it's likely that some of those tests were false positives as well. So the positivity rate in this second test taken on day 5 has proven to be extremely low, remembering that all of these people will have received a negative test prior to crossing the border. So I have discussed this at length with my colleagues and many experts in the field. On the strength of this, I have given a very strong recommendation to the Premier that I believe that performing the day 5 test is unnecessary, and that these resources are better used elsewhere to test people with symptoms and for other reasons who require testing. But I have given the strong recommendation that this, based on the data that we have received within the last 24 hours, our most recent data that we have received within the last 24 hours has indicated that the positivity rate in that day 5 test is so low that it is not contributing in any way to the safety of Queenslanders.